The cranial nerves are a set of 12 nerves with specific functions that are related to a lot of things that we look at in speech production. Each cranial nerve is given a Roman numeral from 1 to 12. They also have names and serve either sensory or motor functions, or in some cases have both. Cranial nerve number 1 connects to olfactory areas. Cranial nerves 2, 3, and 4 emerge from the midbrain. Cranial nerves 5, 6, 7, and 8 come from the pons, and cranial nerves 9, 10, 11, and 12 come from the medulla. Each cranial nerve can be described more specifically in terms of functions on 3 different dimensions. One is the dimension of general versus special, where special relates to our special senses like vision and hearing, and general relates to senses from the body, like touch and proprioception. They can also be classified as somatic or visceral, where somatic is for our somatic system, our intentional control structures, but this would also include sensory information related to those intentional control structures, again, like our proprioception. Visceral is related to the autonomic system, and again, this could also be sensory in the sense that it could have to deal with our sense of taste, for example. Finally, they can be classified as afferent or efferent. Afferent has incoming information, so sensory information basically, and efferent is outgoing information, motor control of muscles. So if we put these 3 things together, we have 8 different ways they can possibly combine. General, somatic, afferents would be incoming sensory information for the somatic system, like muscular proprioception. Special somatic afferents would be incoming information for our special senses of hearing and vision, which are kind of related to our somatic system, things we can look at and focus our hearing on. A general visceral afferent would be incoming general, so body sense information for the visceral system, like the state of our smooth muscles in digestion. Special visceral afferents would be special sensory information for the visceral system, so this would be taste and smell. Our general visceral efferents would be outgoing autonomic muscle control, so things like control of the smooth muscles in digestion, control of the salivary glands. Our general somatic efferent would be innervation of our skeletal musculature, so this is going to pretty much be all of the innervations that we learn when we talk about the different muscles that make speech happen. Our special visceral efferent is going to be innervation of the musculature that's involved in our visceral system, which in our case is going to be for chewing and swallowing, and our fancy names for that are mastication and deglutition. Last but not least, there would be a special somatic efferent combination, but we don't have something like that. If we did, I think it would be something like Superman's heat vision, where you do something efferent out of your special senses, your eyes or your hearing, to make something happen. This image provides a global overview of all 12 of the cranial nerves, including its number, its name, a brief introduction to its function, and red lines indicating efferent activation and blue lines indicating afferent or sensory activation. So this is a place you can go for kind of a visual overview of everything the cranial nerves do. We're going to cover each one in turn. So cranial nerve 1 is our olfactory nerve, a special visceral afferent. Some people argue it's not really a cranial nerve because it doesn't come in through the thalamus and through the brainstem like the other cranial nerves do. This is our nerve for the sense of smell. The pathway for how our olfactory sense works makes it somewhat sensitive to trauma. We have our olfactory receptors inside the nose. They then have to pass through narrow channels in the skull bones to get to the olfactory nerve. So trauma to the front of the head can damage them. Because of the receptors in the nose, they're also sensitive to things like infection. Cranial nerve 2 is our optic nerve. This is our sense of vision. It comes into the brainstem at the midbrain and the way vision is processed is contralateral, but in a slightly tricky way. This image from the book shows the general idea, where you have your thing that you're looking at out in front of the eyes, and each eye sees stuff out in the world that's either on the left side or the right side of the body, part of your left visual field or your right visual field. That visual field information comes from both eyes, but then gets separated and is processed on just one side of the brain. So everything on the right visual field is processed in the left side of the brain. Everything in the left visual field is processed on the right side of the brain. This image swiped off the internet gives you a somewhat similar idea of how this contralateral organization works, where the left visual field is in blue, the right visual field is in yellow, and then you can kind of follow the yellow and blue pathways into how things end up in the brain. The third cranial nerve is the oculomotor nerve. It has motor fibers that make eye movements happen, and this one controls most of your eye movements. This nerve also is involved in pupil constriction and how your eyes focus, which are considered visceral aspects of your system because they can be affected by things like emotional information, I think. Cranial nerve 4 is another eye movement nerve, but it's got one specific eye movement that it does, having to turn the eye downward and either sort of inward or outward, depending on where exactly your eye is looking at the moment. Skipping cranial nerve 5 for a moment, go to cranial nerve 6 because that is another eye movement nerve, the abducens, which turns the eye outward, a movement of abduction, which we haven't really talked about too much. So this would be the movement that's basically the opposite of crossing your eyes. If you could point your two eyes away from each other simultaneously with both eyes, that would involve the abducens. So putting cranial nerves 3, 4, and 6 together, at the bottom image here, we have the different directions of eye movement and how they're controlled by the cranial nerves. This isn't a hugely important part of what we do in speech-language pathology, but when doing, say, a neurological exam, you do have a person track things with their eyes to look for damage to some of these cranial nerves. Getting back to the sequence of cranial nerves, we skipped over 5, the trigeminal nerve. This is our first super important cranial nerve from the perspective of speech. It's a big cranial nerve. It has 3 different branches in it. That's why it's called the trigeminal, because of those 3 branches. For speech production, this nerve is important as it controls muscles of mastication, in other words, muscles involved in chewing, moving around the jaw. And that's part of the mandibular branch of this nerve. The other important function for cranial nerve 5 is receiving sensory information from all over the face. So the image on the right here shows the 3 different branches, the ophthalmic, the maxillary, and the mandibular, and which parts of the face they receive sensory information from. That mandibular branch does go over the jaw. We have a fancy name for the jaw in anatomy, which is the mandible. The maxillary part of that is over the muscle that makes up your upper part of your face, the part that holds the upper teeth. That bone is called the maxilla, so that's going to match up with something we're going to learn later. And then ophthalmic, that's in the region of the eyes, so that also makes a reasonable amount of sense. Cranial nerve 7 is the facial nerve, pretty straightforwardly named, but you have to remember the fact that the facial part of this nerve is motor information only. So this is the nerve that's going to control all the facial muscles that we're going to talk about, and those muscles will primarily be involved in moving the lips around as part of what we do in speech production. The 7th cranial nerve, the facial nerve, also has some sensory aspects to it. It's one of the 3 nerves that's involved in our sense of taste, primarily for taste from the front part of the tongue. Cranial nerve 8 is the vestibulocochlear nerve, or if you look in some older books, it will be called the auditory nerve. So this is our primary nerve for the sense of hearing, but it got renamed the vestibulocochlear nerve because it also serves the vestibular system, which is our sense of balance. So for those of you that are interested in audiology, audiology covers both the sense of hearing as well as aspects of our balance system, in part because of this overlap in terms of the nervous system structure for these. Some of the more recent research in audiology has found some efferent aspects of this nerve, so some outgoing information that helps control tuning your hearing in the cochlea to more accurately perceive what you're listening to. Cranial nerve 9, the glossopharyngeal nerve, is another important speech production nerve. Unfortunately, though, this nerve doesn't have like an easily defined broad area it covers. So the trigeminal nerve, the 5th nerve, was for our jaw muscles. The facial nerve, the 7th nerve, is for the muscles of the face. The glossopharyngeal is kind of a mix of things. This is also one of our cranial nerves for taste, more from the back part of the mouth. It innervates kind of an odd mixture of muscles that we'll talk about in Unit 4 in the class when we do the face and the internal structure of the mouth. Cranial nerve 10, the vagus nerve, is an important nerve for speech production, but it also does a lot of other things. It innervates a lot of our visceral system involved with digestion, for example. Most important to us are branches of the vagus nerve that help innervate the larynx being that structure that makes phonation, that creates a vibration in speech. There are a couple of different branches within that. The superior laryngeal nerve has both external and internal branches with different functions. The external branch is important in controlling pitch. So again, if you're doing a neurological examination on somebody, you would have them say hum, and then raise their pitch, because that's a specific branch of this nerve that makes that happen. And so you can check for function there. The recurrent laryngeal nerve provides innervation for all of our other larynx muscles. There is also a pharyngeal branch to the vagus nerve that innervates a few additional muscles in the oral cavity and is also one of our taste sensors. Cranial nerve number 11, the accessory nerve, or the spinal accessory nerve, is a motor nerve that serves kind of a mixture of muscles from the pharynx, the soft palate, and the neck. And I included the image of this nerve to also just make you aware of how things can be a little bit more complicated in the innervation. So we have the spinal column represented in brown and nerves in more of a yellow. You can see the 11th cranial nerve root, but then it comes out and connects to part of the 10th vagus nerve. And then there are also, there's a label on the 11th spinal root, so nerves coming from the spinal column back up and connecting with cranial nerves, making things quite a bit more complicated. More complicated than we're really going to cover in this class, but you can be aware of it for your neuroanatomy class in the future. Cranial nerve 12 is the hypoglossal nerve. This is a motor nerve that innervates all of our different tongue muscles, as well as a few of our muscles that are below the hyoid bone. But generally speaking, I want you to think cranial nerve 12. That's for innervation of the tongue. So again, that's another one of our cranial nerves where it's got a pretty clear region that it innervates muscles for.